esim another kaswa once abotum na waka hon na enyiwo na ezin koma epeda ya inquiries a you may call them on 030-255-0000 mama sanso me sidibio yentro numbers ne 030-255-0000 na etum na wo so afro one na enyiwo na ezin koma bibia wa kon kana ozamo o say high sense everyday prices everyday people.
God bless the homeland Ghana and make it great and strong. God bless the homeland Ghana and make it great and strong.
Well, my Mr. Asumemo Akwabe from Kastle 90.3 FM Kawadwe no mane hontu dwumezi and anopa we erite no and the tape was be chayen and the Kawadwe no ya asisem kakra yes ye bezin koma because this is an important conversation or chede yenye na yetum na yes ye hujim na yezi na ma me catch on doka batina phone yes nda anopa we yenye Dr Antiri ana ye ne bezi oyen koma wo hade oye specialist hematologist at the Cape Coast Teaching Hospital and afwe osanso the founder of the Blood Cancer Foundation Ghana on and down po we yensa kana yenyi be bezin komo afa oye blood related yereba na no ka wona ase ni nyina no na afa yenyina yetum yesuaze odwumazi be obezi okrom hade yenso yetum na ye take part na bibia wa ye fine before amakodo kan che no kana channel so that we are streaming live on Facebook enti bomboze na fa wo phone no ko Facebook wo search box no oye Kastle 90.3 Cape Coast Kastle 90.3 Cape Coast ekwa like page no na a share ma wona so baby no so wonya bi no so wa hwe wo comment bi epede wo bia no question bi epede bisa any information epede pass bi botum na za afa honom ya bakan na afei yezamo da man so na ko X don so ya active honom TikTok e wo so ya active honom e bia na tina camera to kwan edu Cape Coast ade you are listening to Kastle FM you are enjoying our program. But I do baby na shada anti enkaye. Yes, ya wa Kastle FM app honum. And take it iPhone, another Android phone na. Ko Play Store honum Kastle 90.3 FM. Search for it. Oba na download the app so that you'll be able to stream the program so baby biare will be ano. Da man so na www.kastlefmonline.com. And what's up kwa wonse botum na wa kan wo honum. Afa yo Johnson Street or Cape Coast hade. E pere bana yen bezugwa bra ya ba jodo na bibia wa ya fine honum. For the purpose of our discussions no. What text line no as a buffer 0244 743143 0244 WhatsApp and a text message no for that my line we do as a bar makan na mezamo so doc we are your boy phone lines no ya questions kakra na afei yetum na yezin komo inti mame ko doc ni channel na menje yezin komo kakra. Doc, good morning.
Good morning.
Doc, ana pemeji za unhi
Pacho me huye pa na ose.
Ya da yankopon asma so me huye pa yi. Anope menyu ate da ba kan so Kastle FM anyu bezin komo wa hade. Me je da ba so ya poise for your conversation you bezin wa hade no.
Definitely. I'm so menyu age dem or hasisia.
Me would all fancy no nya group pa.
I must try my best.
Yes. It's for Dr Antiri and anope ni bezin komo da ba me catch no. Or your specialist hematologist or your Cape Coast Teaching Hospital. And after Osanso, the founder of the Blood Cancer Foundation Ghana. On the year baby zoom come. Doc, my starting fi hade. Me just da meka hematologist. You be na kasa yenye medicine and medically inclined tinu. Ya kan ya why na so bebrebe. Ebia for the purpose of me and I you know wo tin na wonyim dwumezi ezi poti no. So ya kada obi a hematologist a. The me pokwa abodwumezi and ozi.
Okay, so hematologist here, doctor, we shiaze wa konenyim na se wo shiaze konenyim a wo shiaze wo muja na yerba okodo wo mujim yawa nti mo yende wo shia muja na hawa yerba kodo wo mujenum na hawa ebotume treat muja mu yerba but se me ka muja mu yerba manka everything when they mujem yerba your infections your cancers your so many things but hematologists no ono or specifically for mujemu cancer na other things are all affect bibi or friend red blood cell ono mujenu specifically nti asa ye bon komo no me checha se kakra but hematologist here doctor we sua zo akọ n'enyim we sua ze how obetuma ye diagnosis wasan so treat moja mu yerba bi today cancer, sickle cell disease, hemophilia ena nzema bebre.
Doc, it's me that's a part of tum na achem de mineza me ntimi jizi da one hour take program no say yeka do be hematologist and doctor achechim ma yotum na ya tase. Doc, me bo wuzin no me share na there is a foundation also you're the founder for the Blood Cancer Foundation Ghana. My young foundation, what do you do? And then abajumezina okodo hono.
Okay, me that's it. Inti foundation of friend of Blood Cancer Foundation Ghana. Yes, set up foundation last year, December 2024. Now, the reason why I set up this foundation, me a Dr Antiri, and over the period of 2024, from January to December, you realize the young patients now wabano. Now, for the past years, you find 2022, 2023, no, up to 2024, you there na wuru. Etasa oroko sir. And yet na sini share there, even as into no. And there's some of the reasons there. One, when you're aware of blood cancer, when you're aware of mujemuko cram.
Okay.
Because when you're aware nintino, ma osinye there wo betne fie na wa fufufufendru wa ye won zema bebre ansa na wa ba nto ba late. And secondly, wo ba so so a wontum nto ndru no se test kra na yepedo ya wontum nye test no nti oma diagnosis no oyezan. The other thing so there yenyi bibi or friend stem cell transplant into later on yebeka wasem or yaza or ye long term plan hoping there one day able to set up such a thing. And as a bebre there are lots of problems as to why and these are preventable. Me team no was yentenas and set up a foundation now on a formal way are able to address these problems into them about hey make awareness you be a program for awareness later on no nko fumpin for better na later on there oh CCR no bibi dem ho into yemboa na ebia yemfa blood cancer and health insurance do so binya bibi dem we to matua ne bills we to ma to drew we to my bibia nti ona no ma set foundation just to address these issues wa mankofo and impinfo wona so ate no wa aboa yem patients.
All right, Doc Medase take for higher Kastle 90.3 FM Kawadwen Mane Honto Jumezi and anopa we was so good at no and the yebosuazi yebohwehwanyama bebre intinde yensa ka oye Dr Emmanuel Kastle Antiri ye damro ken wa teach mo hade oye special hematologist our Cape Coast Teaching Hospital now kriaso ye the founder of the Blood Cancer Foundation Ghana and anopa we ye nesin konya ye izin komono so na ma make catch on channel so maje wadwe ne che question bi ewo another bibi a wo se contribute to the show no one our friend Brandon nso ya nti wonya abotere mam kakra. But then for the meantime, able to as a text message and a WhatsApp message, as a for 0244 743143. Na as a beze ba mashana makan na mazamo. Doc, my message member won't be away. And the yebo suyazi, you have found a yakwa classroom in the yauna specialist wahade. Na where's me be the basic question, mommy says, me use a but then for the purpose of your discussions, yen chim na bia it's yenete phone to na one na say. Doc, say yaka boja ana moja oye ibanaze ana he for so no moja yenya yezifi.
Okay, inti so waka moja ye insukoko yewa insukoko a onam nyimpeduani mu na se yaka bibi so a we moja ye moja wodompem. But before I remember baby a ye moja no ma men kire blood na se better. Nto yen sukokwa onam body ni mu nto okọ bebia okọ yen tirim okọ yen akoma ho okọ yen sim you mean say am move up and down or moja nti no ma mutumu move because moja nkọ ho na oche there ahozen na oxygen na other things are uhia there or them movements no ontumu nye etasa nti moja ye insukokwa onam yen tinimu na moja ni mu no nzema bebre wo moja ni mu most of moja no ye insu. But what in Sunumono, and there was a moja entum for you hu there as the womb. But my one there or your cocoa. But in Suno, in Zama womb, na in Zama womb no your friend or red blood cells, white blood cells and platelets. And he said so betum a project am ankofa wo hwa we betum ahwehwe red cells, white blood cells, platelets. Na se efa them are cells here, red blood cells no ono no ma moja no ne color oye red no. Na red blood cells no mo oye nye de offer oxygen from baby a yehomefa no ozi fi baby a yehomefa no ko all other places. Na say you use oxygen ni we are wasana for carbon dioxide no from into carbon dioxide ni waste product obofa we fi ho oze poi afa baby a be ebe homa afa no so. And the other thing white cells no ono ma oyenye de or protect yen against infections. Nti say white cells no foma ebon de bia na eyer enya urine infection, enya pneumonia, enya infection wo moje no mu. And lastly, you will be offering the platelets. Okay. Platelets no say find this baby twa on na when they say enya kata after some time no we twa. Okay. Nti platelets no ye dem as no oma moja no twa. Nti say o chede o fuma moja no botumetu dem ma moja no asa. Oh, okay. Nti efa moja, these three things are the main things: red blood cells, white blood cells, and platelets. But apart from that, is there be nutrients? It is okomogenum na ozna ko various parts of the body. And oxygen also mark on some that there be brave. Into moja no as simple as you them there. Oh, moja no san on but in zama be brave. Obwa okay. Doc can put I'm in education. Me just then do be say you when we be a moja of you but na come moja fi endom pem and oba beautiful. Yes. And that is interesting. And doc you go na nyim kakra. Na I am most at times I tired today obi say ni moja levels no wo form opodo nya moja bi mo so coffee the mezi bani konum the medri fa way na yan share the natural means able to na ye boost or ye blood levels no. Okay. Nti say if a moja under normal circumstance no de wo ye no ye moja form yen bone marrow which is dompenimu semeka bone marrow nche area obia almost obia wo ha bia ware akokoda de akokọ no ne edges honom no de ohososo kakra ebu honom ne de as red bi wo inside hona moja ye moja nti say ye moja na ofidompenumu no wakọ moja no ankasa but as a year no de woman ye moja da won fa moja nsi wodo da nti ebubu so ho de oye de na ye moja yebutuma ye moja wo ezibana yezi nti from enyi ni nyina no ezibana ezi no ono na body no obe absorb nutrients na owo ezibana mu oza akomoja no mu nti say for red blood cells dem main things in here any protein, iron, vitamins. Inti ni na so fi is bana yezi no mu. Inti de bia se eba na se yehwe na se reason why umoja no o form no ye into munziza ye baka cho de o zi dem is ban ye dem na we boost umoja no se ye feel so that onye is ban but or other reasons maybe or some year baby into normal umoja no sukofuma ye baka ni nyina cho but mainly naturally se pede umoja no okosura is all about eating well, eating a well balanced diet. And apa say sorry benya ibia o Tom Brown be some milk akra na inya o brown bread be na 2 eggs be our home because eggs no it has a lot of protein. Na area bro so inya some beans be also so very high and rich in protein. Tinya bibi dem na enyimbre so say enya wo apem bi na nkontomria na easy na ye natural sources of vitamins na iron na protein na obutuma ama ye moja. And let's not forget about fruits. There's the fruit count because fruits no contain folic acid na vitamin B12 no inti say area moja na say enyi these specific vitamins ebon there ayi moja no but until they need them vitamins. No? Okay. Moja no intimi it's all about eating well. And see not today say we explanation merita say ya say is the balanced diet naturally no moja levels no fine. Absolutely. Oh, okay. It's a balanced diet. Your blood level should be fine. Oh, okay. Doc Medase Pa, it's for higher Kastle 90.3 FM, Kawadri and Manahonto Jumezi,
and no power so good retain no ndam be catch the special program and a yare yenye na yerusuaze dwumezi bi bokodo Cape Coast hade yenye Dr Emmanuel Kisi Edu Antiri specialist hematologist wo ye Cape Coast Teaching Hospital and afi osanso the founder for the Blood Cancer Foundation Ghana and then the wabetini fiade yenye na yenizu nkomo no me just the explanations ade kire na ozire maye no yenye na ye jot down point no yerusuaze na yetum na yenye na ya hwe ye hu ye na yezin nkomo akro na nde ya hwe hematologist dwumezi awozi foundation dwumezi awozi another way we Ghana hade and ya hwe ye yen mo jesu yezi hu nkomo kakra ye wa classroom ye bokoy na nyima step further na ya elevate and discussions no it's no wadwen chebe wo bia na ba me catch on fa 0244743143 as a ba mehwe na makana mezamo to the tail end of the program no ye be phone lines no na won so won concerns and a question be put be say doc no so wetum na wa ma answer na bibiara wa ye fine ti kan ho na yentum na yen say true na yen koyi na nyim doc sisi abeba ye bedui yenzu komo kakra mfa oye blood cancer ana mojamu kokram. In fact, cancer yereba obi atepene na yemhihyen. Or yereba you don't even wish it for your worst enemy. Akwa hematologist yaka blood cancer or ye eba ni yereba and aba symptoms na oba chere obi enya oye dama yereba ni bi.
Okay, but that's it. Inti before able to mat how blood cancer is no na wode hu as a cancer ye. Me feel there I think the fancy what cancer or ye kokram. Into kokram me sure that yem bebe obi orite bia wat kokram da na kokram no otumu si wo baby a otumu si wo wenwum obetumu si wo wenufum obetumu si wo skin nodo obetumu si wo yem baby a home fa no obrebo kra otumu nya cancer wom na obetumu so nya cancer wo baby a pancreas baby bebre but me hematologist intimi focus here on blood cancer into kokram yerba bon na ma oyene de say efa every body part your free BB cells and when them start saying on make bone marrow and I'm say there are cells in it because ono normal organ no into what cells are cells no bobom why BB or friend tissue na tissue so abom organ into cells na make one some red blood cells white blood cells na platelets no ono na cancer no tum etasa inti se efa cancer no start wo one of the cells inti so ye we nufa one of the cells no we nufu no mu otonchen asemsi wo cells no mu na se oye dema na wa multiply can multiply why the why bebre
why bon
aha why bon why bebre
okay
na oye bebre so sa obe move efi baby or one wa famoje no mu akọ other places so baka de wa metastasize we fi baby or one ko nti cancer ye babona or start wo baby one place or ye bebre na wa asanso e move but bebre no ye no onye aza e wodo ye dem it has under normal circumstance no there should be a control
okay
but cancer no there's no control on another or na nori or you be breed them but sometimes no was will be when ya zika crebu on no con ha but later on kasa or there's no control grow no grow into move the man way if you want to say for blood cancer or you basically kokram osi wo mojenum but mojenum no maka cho the mojano ye onzeme basa red cells white cells and platelets
okay
into kokram no obetumi esi or red cells no mu obetumi esi or white cells no mu obetumi so esi or platelets no mu na we move later on we move from bone marrow no mu wa other places but say if a blood cancer so on yet just from the bone marrow and when them start to there ye moja or start to dump no mu bone marrow no mu until if bone marrow no mu ofi wa other places when they say when the Jesus sometimes and even up till now adults cry sometimes any infection we no man that be twe wo kon
yes
wo friend edoa wo friend lymph node o twe ye wo kon ha no ha inti bi them as no so oboa on so kan bi ye mugye wom inti sometimes no yerba no e bia on start to bone marrow no obutuma start wo ho another minim that is spleen so that if wo free BB spleen on no the brebo no right side liver no right but there's another organ now wo free spleen or left on so or kan homa ye moja inti se enya blood cancer obutuma start to spleen no until your baby bebre but just there main one here bone marrow and other places are here moja beat the spleen and a lymph nodes no.
Okay. Doctor, me just the way or a scientific point of view na amayati asino and then you have a fun with them because wait is ya kwenyimpa but then ebia me mama mbite papa mbite program way in fact I'm also interested. Yes, now you baby yerba no ofi na oba abanyan so yen lifestyle bi and all contribute ma them or yeah blood cancer way or to man so ba sana abasha risk and then prevention.
Okay, into lifestyle say if a blood cancer there is no specific cause for most of the cases into infant death cemetery hospital na mash 100 and 400 abam ho there monshon na we nya blood cancer about 90% of nkrofono and more than 90% yinyim how or start into or chede or hwa and or start
Okay.
Into memo good examples you find there about to cake na ehia basic ingredients be as to cake no you find there in chief akor you find there cake no there ehia nutmeg ehia a flour ehia nzema bebre but in chief akor bi wo ma wa say says in them in chief no as a cake na ebehu there cake no eya ni taste no onye del every crowd there will be a smell so it has into that is all about cancer. Before ebeye o blood cells no cells na maka wansem no today ebeye no as bibo touch him one of the cells today manchifua asemesi wenchifua no one of the cells no asembesi cells no into one of the cells na asemesi wo ho a ono na obema why bebre wa be cancer no but them asem no see no sometimes eya yintu me explain aza or start say into a friend idiopathic most of the time no yim aza oma osi ebeka do ye genetic there or ye na there's a mutation or ya acquired onye there inherited from papa na do mama no there be e wo hwa na osi awpe no we see onye there say wo ba so obisi there be or ya wo special to you that apart from them are spontaneous or random occurrences no so your other exposures into your environmental exposures. Your environmental exposures are ebinye there in kofa wo yejuma was benzene and chemicals was yejuma. Into good examples in kofa wo use paints. In kofa wo yejuma wo petroleum industry. Kofa was a rubber or yejuma them are rubber manufacturing industries no. And there are some chemicals we want more friendly benzene into onye there yejuma ho ebenye bi but oye there yejuma ho no and protect yourself into and share mask and share gloves and share gown on an day them are constantly exposed to gases na ofi ho ba no de bia na ehua de bia na ebi nam mo skin no mu ruko moja no mu over a period of time no likely to get such a disease. And the other things also radiation ejuma wo baby a de bia we use them radiation na rays na ono so or possible they able to manya yerba bit these are some of the causes. But before then ebusam earlier on about symptoms na science say in blood cancer what are some of the symptoms and signs inti say in blood cancer the blood cancer no doso you different types but generally because cancer no affects cells na kokram no or be affect cells na maka one sem no which is the red blood cells the white blood cells and the platelets no or affect them cells into no bama well the way I express ourselves no will be based on how our cells no are affected et asa inti say red cells no are affected about the et na hwa bibi kakwe bia na abre et asa first into them benyinba is be 30 etumu nanto f4 stairs equal up and down or chance na abre but for be 1-2 be jide jinana ajewa hom into no so che there umoje no o foam sometimes so wakoma bobon tentem se nanto na why the way you do chin eja homa na ebre ni nyina o signs and symptoms are say umoja wo forma ebotumi nya bibi dem. And secondly say you find affect white cells na won the or de bia na erbo because enya pneumonia enya infection or baby home fa no. Secondly baby you sanchi fa no so ebotumi nya infection wo ho won de kura ye wenum. And lastly so affect platelets na one there moja randomly otumu fi wo hwenu mu ba ana de bia etwitwo sa se brushing cry soft a e na kakre bi pe na moja fi bia etwitwo so no orba etasa every morning bia ye dem a ehu sometimes etwitwo so cry be hwenum na moja bebre ta ana de ko toilet ehu moja wom you sancha ehu moja wom ni na no che the platelets no why are affected because cancer no wa start to bone marrow no and wa affect cells na ma kan wansam no che de bibi dem ho na the other things ni there sometimes we don't pain no obutuma yo ebi no ho beka de menya bone pain e jam rheumatism or you know what be for painkiller for painkiller bo na or you cancer yibi nti say nya bone pain or there by hospital you make sure there test be your friend full blood count on obo me moja levels no na other cells no ni tumi hu de BBI fine, ebi kra no sickle cell disease, ebi kra no ye bu hu BBI na aka. See, these are some of the common presentations.
Doc, inti ma bisa way na yemfa this aspect in see. So now no yes come about the symptoms and signs, now we know about how it comes about the risk, Now is it preventable?
Okay.
And prevention, no.
Yeah, absolutely. In see on the ebusam first question ebusam about risk,
Yes.
And I'm kind of some of the risk and some of the causes, It includes random occurrences. Ebi ohwa no esi or friendly mutations or cells no. Inti on a good example today say call cake na say inchi fa kra say ebo hwan there cake ni na wa basa. Inti no sometimes into moon prevent or no into me ho hwe or just random occurrences, but my able to my ho bibinye examples amzama no say ye juma o baby a use benzene or as in today a painter na de be a painter and the painter for no sometimes will paint the whole day and sana waka kugwar and sometimes will painter one shirt gloves one shirt a what can then mask one shatara or my paint nka wonsa tasa nti say e yejuma o baby a as a chemical yejuma or they make sure there ebe she protective gear or be reduce wo amount of gases na ebo ho na ma obeka wo skin no so be reduce ni nyina na say yejuma so wo baby a x-rays na gamma rays na radiation or those wo ha ono so say be make sure there be she some lead protective gears just to reduce your exposures. It's all about reducing exposures. Or be protector because definitely one day would painting and then say because of those exposures, say the benzene woman no chair then would be painting and they would paint, but just there will be painting. I would make sure that wash these GS just to reduce the amounts now or be get exposed to.
Okay. Doc Antiri yadasa pan and checha is ama here no for higher Kastle 90.3 FM kawadwe man honto jumezi and also good at erite no message we yaba but then you're busy come out for treatment on last before you come to the foundation jumezi or busy or you keep course a day. Where you say Mr. Host, I want to ask the doctor this question. I went to a hospital and I was asked to do an abdomen scan. So I did. And I was told my spleen has increased in size. But the doctor told me that he isn't a specialist, so I don't know what to do now. International message, Dr. Zabente Bia. Ya fanka treatment no na for your answer the question na.
Okay. Me answer the question first. Inti say who spleen no why enlarge that and now hona. What them me kind there spleen no so can.
Yes.
Organs now what ye moja no. Inti me advice there bra hematology or intervention. Obutuma aba on any Wednesday oba bra consult room 7 na yɛbɛhwɛ no ɛna sɛ yɛka treatment no so a for treatment no sɛ ɛwɔ blood cancer the main thing ɛwɔ dɛ yɛ treat them meka the blood cancers no dɔɔso
yes
yɛwɔ leukemia yɛwɔ lymphoma yɛwɔ myeloma yɛwɔ Waldenstrom's yɛwɔ yerba bebree
doc abɛdi nta wɔn yerba a ne din dɛdɛɛdɛ nso ɔnyɛ yerba papa
ɔyɛ asɛm kɛse paa
leukemia
ɔyɛ asɛm nti yerba no sɛ ɔdɔɔso ɛmi yɛhwɛ dɛ ma wata nye leukemia but yɛwɔ bebree bi wɔ hɔ a wɔn fedru ebi wɔ hɔ a wɔedru do ebi wɔ hɔ a yɛrehwɛ wɔn like wɔawɔ hɔ for many years a hwee renyɛ wɔn nti sɛ yɛka blood cancer ɔnyɛ dɛ leukemia ɔnkyɛ biara leukemia no koraa sometimes kɔfo de nya ebo wɔanyɛ daabi ɔnte dɛm nti maame kyɛ wɔn ase yie sɛ wɔka treatment na the main treatment in general sɛ meka in general kyerɛ dɛ ebi wɔ hɔ a ebetumi use ebi wɔ hɔ a intumi use but in general all blood cancers say be treater or stem cell transplant that is the cure nti ɛpɛ dɛ etu yɛreba no ase permanently or stem cell transplant nti sɛ meka stem cell transplant a ɔyɛ dɛ sɛ onipa koro na ɔyɛ yɛreba no ɛwɔ dɛ yɛ ma no eduru a na no yɛ hyew yɛzi yi ne bone marrow cells ni nyinaa cells a ɔbɔ ama ɔyɛ no mogya nyinaa yɛbɛyi ne nyinaa fi nyimpadua no mu yɛwie a obi a ɔyɛ ne match a today another person a ɔno onyi yerba ni bi a say yes ɔno ne one of the cells no yes mana obotuma start bibia bi mu wo onipa ko na ɔyɛ yerba no yɛbɛyi ne ze ne yes ama nipa ko na ɔyɛ yerba na yɛyi bibia fi ni mu no yɛbɛyi one of the cells no yes atunu mu na ɔno wa start bibia biom nti ɔno ɔkyɛ dɛ yerba bi enyim bibia or start afresh it's on your stem cell transplants, no. But apart from that, some of the blood cancers, no, to some extent, able to make use treatment. That treatment, make a treatment in terms of chemotherapy. Okay. That chemotherapy does. So make a chemotherapy. Why there? Idra na no yesho kakra, but otumu treat cancer, no. Nti ebi me sure that me that chemo da chemo da etiefo na mo hwɛ dɛ motum nya simple word bi amo na but basically eduru ana no yɛ hyew kakra
ayara doc yɛ taa hwɛ movies a wɔn ne so bi kɔ da ma cancer treatment ne bo ana bɛkɔ wa abɔ ne sakura na wɔn na kɔhyɛ machines bi ana yɛ taa yɛ nyim da wɔkɔ ne chemo yes
nti ma aka na anyan today ma ekade nitu sakura no because of edru na no ye hyew no edru no se edru na e de yezugu moja no mu se okomoja no ma edru no onko just to cancer cells no okọ to every cell bia already divide into yen de utin read them eya no asenefu etasa sperms them every time bia area sperms and I think those main tissues, but say Emma edru no oko cancer cells no, but only specific to cancer cells no, or be affect other cells to the routine or sperms na other things inti ebe treatment no the routine no why sakura but full nicely after say eje edru no kra bibia bo full nice and sperms no so sometimes it may affect fertility but to some extent able to asanso regain fertility. It's back to the treatment, no. Apart from stem cell transplants, no, able to say use chemotherapy ya kan wan semi. So you draw was be for unsem and they be or how men or your tablet able to my men. Na ma oyenye there okwa obokwa kububu cancer cells, no. Inti se efa dem edru ya for leukemia to them yetumu ma won edru no che do for be 3 years. Dema to some extent even by 3 years no na yerba no wa brase or friend remission on chede yerba no ko but wa brase yema na time on cc sometimes we to see afterwards but I mean obotuma chair and some asanso abebium into na make dey say pede cure e would use to stem cell transplants but e bi wo ho a ya mon kimo na yerba no ko wan bebium into odededemu etasa odededemu ebi so ono zen what they be use treatment no cry or they go straight to stem cell transplant ebi so use kimona obaboan because ono to mama why cured.
Doka no pay ya dase sronko pa de etumazin chechem we nyina exam yen metis de kofu brain na they are interested in this conversation bi mo good worry free you want to be mobile phone lines na also question bi e pede ebisa doc no etum na ebisa aha Kastle 90.3 FM anopa we yenye oye Dr Emmanuel Kisiedo Antiri specialist hematologist wo oye Cape Coast Teaching Hospital and the founder of the Blood Cancer Foundation Ghana and the Yenizun Koma wache mu wo oye blood cancer and its related issues in no. Doc, before mama call us no, that there is going to be an upcoming screening and blood cancer awareness program wo oye Cape Coast hade. Mpocho maye hu oye damu jumezi any fan obayen and then what do you seek to achieve with oye this awareness program way?
Right, so that's it. You see me starting on about yen issue a yenya or yen patients no the fact that worry because want me basic things be today wabana mojenyi ho wabana a drop at water untumunto untumun yon labs nzema bebre inti as part of this process no on a foundation but foundation no on the 5th Onye penny ye be juma that day yenye ya collaborate with Firma Eye Care Services. Mean that one kada one what make a diagnosis with you no glasses now what yenzema be with you and see one so be around Dr. Echo Ampia and any team and yenye University of Cape Coast medical students no so that day no you able to when you know be around inti my be yenye there you be free eye screening.
Okay.
You be check one vitals. Vitals no e be nye there e be ho ni BP cross check ya check. You be check one pulse. You be check nzema bebre obe check there wapo muzen oya na do nye. Na ye check so you too for as to what to do next. They be a be kade okay koneko mu doctor and I dey able to drama and maybe be a able to on that day amo.
Okay.
And the next neighbor yenye there you be educate one so about blood cancer even though maba can be hano on that day so be obe baby and yes so be can asem na chen nzema obotumi amehu there in your blood cancer in your bibi dem baby as we nya so betre.
Okay.
And lastly you be check one blood level. You be check one blood level because are very important on the issues no or start with dompenimu or start with cells now or ye moja no inti se umoja wo fuma obutuma change them bebre e bi kra no onye cancer per se e bi ano ye bi enzizi ono so se ebotu for enzizi na ye fine. Inti these are the main things ye be start with Emintimaze Palace.
Okay.
Ono ye on the 5th of May. Na inti Monday your be
Monday Emintimaze Palace.
Emintimaze Palace.
Okay.
When ye call first. If you are on the 10th of May yeboko kotokraba yeboko a market
honum
10th May on the 10th May
okay
yeboko honum yebe start oni na yebe start 9 a.m. and on the 13th of May yeboko abra 13th of
okay.
May yeboko abra the same yebe the same thing wo ho na finally on the 28th of May which is the World Blood Cancer Day. Bibia be celebrates yeboko UCC.
Okay.
Honey is baby. Na ya do bia so obi oboa you no bi obaby ya da na ase.
Doc Mpacho my dates no nyi locations and CDB so that it's here for you to notice.
All right. On the 5th of May, you will start with Emintimaze Palace.
Okay.
Now on the 10th of May, ya Bakotokraba. Na on the 13th of May yako Abra.
Okay.
Na on the
28th
of May yako UCC. Nina 9 a.m.
Okay.
See, although biaba because maybe we check umoja level that ye be any free amo and check u BP and check u pulse and check u inyada. Nina ye be any free. Nzeme maybe who be also ye be more advice as to what to do next. On your day, you need or them are there. You be making sure there you be see you through my Hazor Kodo.
Okay. Doctor, that's a part no power way. But before then, no, me to me German call the man. My mama call us in the so boom. My for course by 3 pay and now 4 maximum. Na eba but your question be bisa monye brief na doc wetum na wakwa kwezi jumatu so be for so 0244 408046 0244 408046 and answer the 0244 408354 0244 408354 mama for first caller wahade Kawadi
So Osman.
Come up here.
Yes, please. How are you?
I'm very fine, Pochana Waswe.
Yanko Pana Dachamuka. And when Yanko Pana to Musu Papa, the man do you know, and the pay will bring in a member. One can create me when you're bindi. In such a Yanko Pan or some Papa, different as Yanko Pan first. Some me dog. So you know, obey ya, Mamma. Information centers. I'm one button, uncle, not indicate one on farm. Because anything near Kastle FM, OC and Nario Sim could get to the Tibia you take. Now, Yama, you never know what I have, Papa Manatano. I don't know wishing into what I will take.
So once one spread information, one spread it be I. Once I can be agent.
Oh, not only yes, I do not dog drinking. Oh, no, you know, Papa, and a permanent on our uncle, Nana, Asankuma and San New Groom. I can't one on Maminchen and a pay eye, but that's the doctor. Mamma, limited to Nayam alive, but that's it.
That's Mamma Faway, so had a Kawadrin.
Well, one, two.
A part of the breakers free.
But our former coach, you could free now.
Yes, boss, you're 2 1 poet. I'll question babies and I call.
Tell me, said there is a luminal being the palace. A red name. No, to my boss or more.
My watch out, say, yeah, if more answer, I. Yo, and I see Mamma Faway, so had a Kawadrin. My part was in a baby free.
Yeah, Mr. Speaker, make a secret with you.
Yes, you're 2 1 poet. Question it.
Yo, Mitia, a key for my associate cancer. Mitia, I have for some more show of Facebook. Mitia, Mr. Hifford. The camera and the can meet me.
Okay.
Let me tell you, Mr. No, so accurate. Then this a question. Blood group na cells ne blood cells na dem. Owo yowo engineer this you dey use cream. Ma yembo je no oni yese no oni yope. The doctor oyi man no because I ko hospital say dia obi enyembo ja. Parce so obi so abi no dey me na dey. Pede donate man no. No obi so bisa that question. Pede doc o change mu. I'm doing my man corner.
Okay, Mr. That's my last caller. Wahade Kawadrin.
I don't want to.
My patch was in the free.
But you doesn't feel bacano.
That's it. You're still senior.
And I pay the doctors if I family is charging. No, nothing this window of the painted as only there's the mechanical woman. So, water, women, water, or exposed to the mechanical with one. Naturally, will be a fun and you painter. No, I painted for over 2 years. In the molke, onshore gloves, onshore nose masks, onshore launch with protective boots behind naturally. Or when Sunday between your butts on Amawa. And I know some example with one way more rubber factories. I was up in the put on to the mechanical. It's a rest of the apart from so. In a sanity fee. What to actually do not cook a giddy ya. Ediana, the mechanical is supposed to answer. Obutu cha chene ne ama yenya ambambo do kwase onde dufu ya ta ye juma funded protective gears na no on shira hanfa hu she tum ko so mil she dusty obeshe safety safety goggles so na hina wa chi ne nwa the one where this aluminum works when you know which machine the particle to be what akoto him the safety goggles what na wa chi ne nwa gloves what na hin or me se bocha long sleeves I mean koto ya hin safety boots or him to compare the near them. Say, doc, apart from them, you may be near Indiana, aware you between them, maybe so once and not for ye out there, the young fun. I mean, think of me a bit.
That's what I say, yes, but that's a doctor version of answering in Anna. You to know, yes, sir. I may tell for mum for ye of Ruffle be having to me so fine chum. Breno is out could be Musu wins him now. Doc, but my answer can crave on some of the questions I will be saying. No, doc, Pacho answer just some few ones be now. I think wrap up on the show.
Okay, inti for last question no, honor or my answer no, inti minimum jumo ye mum, but say ejuma bia obia ye no today ye na ye ejuma hospital dey your gloves are ye she nti ejuma bia ye no we make sure there obeshe no protective gear minimum ye but just or make sure there say or you be no so or feel the cancer no wash gloves or be funny him wash nose mask no so and the second person I think will be about Mintimaze. But ono there ya in the different days into Mintimaze no ono ye for Osaberima.
Oh, okay.
Name paying for no. It's a son nananom no.
Okay, so on your opinion for the public.
On your
no?
opinion for the public.
Oh, okay.
Or ye for Osaberima. Kusiata the second
okay.
Call for.
Okay.
There were some other.
And obviously beside there your different blood groups, you know. But if we are hospitalized, but
you make them a question. Oh no, say we busa them a question now, or just because we do who there is easy fine because in Pakono was a moja common no, on no moja will form. Inti say our in this year, no cheddar was cells no on your healthy enough. Into they will make sure there was cells near healthy enough before mojano into just to make sure they will mojano or a fine is easy as a woman on pakunu moja or be a fine to one pay any unhealthy cell be
okay dog into ya can the maybe no me just the ndezi nyina yesu has and the nebe bonyama no do that train awareness no bokodo and yan kan nyina yen fonfo a o final remarks and then people of Cape Coast Central Region Ghana obia retail within just 1 minute and bonus to find out.
That's it. The main reason why I'm behind in there, me pede Cape Coast for what's there, or free BB blood cancer. Now blood cancer no, or cancer or start to bone marrow no more, or affect red blood cells, or affect white blood cells, or affect platelets. And now you who so there, you patients need to be when your issues because want to nyenze be brave. Inti pede. Ye create awareness. Ye mo biate there is blood cancer in Cape Coast. Into onuntin ye pede ye screening exercise. Ya bodate na dada into wodo biaba. Ozen hu beshim wo beshiaze ye botuma check in zema bebre amon na woni nyaje. And finally so we there we make sure so there will be zizi. That's one important thing. So oba making blood. They just have to eat very well. We be zizi balanced diet one moon so. About 6 sachets of water every day, and that should be it.
All right, doc. I know pay yeah, but that's what before about continue for Canada being na
okay, and see so before I ever make here me colleague collaborator Dr. Eko Ampia and me busian funina Reverend Otopa, Mrs. Florence Otopa, Ebenezer Esther and a real Sam.
Okay, doc, I know pay your das a part of a kayan why but to my training in our hadi. I tell for Jumaza had in a yabasha na yezi besi kawadra manahontel. I'm a power and Dr. Emmanuel Dr Antiri, only a specialist hematologist at the Cape Coast Teaching Hospital. And also the founder of the Blood Cancer Foundation, Ghana. Na any cable mandano power yezum komo eza for ye moja na moja kokram another blood cancer home. Enti me just da nsema Kenya ye nyina ya ati emfanye adwuma na ntum na yensu a. Afa so the date na azin ya za me ntu no kotakra ba afa abra na UCC from 10th 13th and then 28th respectively work ya kotakra ba abra na UCC. Ye nyina ye nkwa na ntum na ye fa ye hu njim na bibia on kusonwa no fama ye enti ahana dwumazi no yeziri si enti bebi bia wo bia no kasafiri no manyi mfi hade continue listening to Kastle 90.3 FM from Osman Ademu from Osman the Venga Majodo. The production team was led by Mr. Bernardo Go afa DJ Black who's kan hu bi kwame na Esuman FKK obi biara boy dwumazi we yeze bro enti kasafiri manyi mfi hade na ya morning dose of your health issues into my health is next on your radio. Continue listening to Kastle 90.3 until then. Good morning, Friday. Yami and Adoma Ibesha on Kawadron Manahontodo.